So in this video, I want to walk you through 3 ways that you can treat your shoulder pain at home right now. All you need is a Therex band. This one happens to be through Power Systems. You can go on Amazon, type in TheraBand, and I'll go ahead and leave a link below too if you want to just check out the ones that we recommend. They're pretty cheap. With Amazon, heck, they can be here tomorrow. So anyways, you just need a band, and we're going to show you 3 ways that you can actually strengthen, get some good blood flow, maybe even loosen up the shoulder, that I found are very helpful for those that are kind of even recently flared up, a little irritated. So let's give it a shot. So what I need you to do is grab the band with your palms facing up. I'm doing it standing up. For whatever reason you need to be seated, you could do that as well. So find a decent amount of tension on it. I'm going to put a little resistance on it. Arms are about shoulder level, and I'm going to pull all the way back. Okay? I'm going to squeeze my shoulder blades together and almost kind of arch my chest at the top, right there. So I'm pulling it apart. My arms are as straight as I can go. And if you can, get a little breathing involved. So we never seem to breathe enough, so we might as well incorporate it with some exercises, huh? Now I am purposefully trying to go a little bit further and further with each rep. Okay? Deep breath in. I do want to make a note. It's very important that you don't shrug when you're doing this. So in other words, I see a lot of people doing that. Please don't do that. That's not what you want to do. Think about keeping your shoulders down, away from your ears, and then do it. But otherwise, you know, if you're doing that, then the exercise won't be helpful. I just want to tell you that, to be very honest. Shoot for a goal of 2 sets of 15 reps with that, with a 1.5 minute rest break, okay? And if you need to kind of just warm up the arm a little bit, you can try to do that. But otherwise, this is a pretty safe exercise to kind of go into right away, okay? So if you need to, pause the video, go try that out. Otherwise, let's just keep going. So with our band, again, I'll do it standing. This one's tough only for the sense of I want to make sure you do it the right way, because again, a lot of people shrug, okay? The overall intent though is actually very simple and easy. I just want to make sure you do it the right way. So I'm going to hold my arm with my thumb pointing up, my elbows about shoulder width, shoulder height. My elbows in front of my body, not behind. So I just want to make that point clear. My arm's bent to about 90 degrees. My left arm is going to hold it steady. And what you're going to see is that I rotate my band up so that my forearm at the very top is pointed towards the ceiling. I said tough earlier because I get a little bit of that where people are shrugging, or the elbow drops, or the elbow goes back. You know, so we don't necessarily have you putting that on like a table. You could, okay, if you're really struggling with this, you could, you know, find something like that to do the exercise. Perfectly acceptable. I'd like to think that we can get you to do it like this because it does require a little bit more co-contraction and stability. So it might be a little bit better. But if you had to use it on like I use the example on this table here. But you know, if you had to do it seated on a table, you could do that. So this is the second one, just keep the shoulder down. We're gonna keep the sets and parameters the same for all these. You should be working back here. Quite honestly, with all 3 of them, I don't want you to feel it in the upper trap, and it is okay if you're feeling it back in the shoulder blade. So that's the second thing I want you to do to help treat the shoulder pain that you've got going on. The third one with the band is that this time, my left arm is going to kind of hold it out to the side. My thumb's pointing back behind me. My elbow's pointed forwards, and my forearm is in line with my shoulder. What I don't want to happen is here. So just make a quick check that you're not out here, but you brought it in. Once you've got that, and for really all 3 of these, make sure the band tension's appropriate. If you're just like cruising through them and they're super easy, you're probably not giving yourself enough resistance. You should be kind of working out the muscle and feel it kind of warming up a little bit. So we're here, I've got my good tension. I'm reaching up toward the ceiling, holding it at the top, slowly coming back down. Biggest mistake I see with this is as people get halfway up, your elbow's kicked out. So keep the elbow underneath the wrist, drive it up, come on back down. Drive it up. And if you're noticing, I'm really trying to straighten my arm at the top, and I'm almost trying to reach up toward the ceiling. And I do encourage that. Okay, I do encourage that. Let's get our breathing going again, huh? With a simple little band at home, it's amazing how difficult that exercise can feel. So in total, we've given you 3 different exercises, 6 different sets of 15 reps. I would keep the 1.5-minute rest break pretty consistent. We want to allow time for the recovery process. We are trying to strengthen, get some blood flow in there. So I just found that's a pretty healthy time in between each set. Don't do any of these, of course, if there's any sharp pain, and this doesn't seem like it's getting better. We're here to help you. But I did want to make sure that we gave you the opportunity to start to try to take care of this on your own. I know how frustrating it can be. So thanks so much for hopping on. My name is Dr. Chad Kuntz. Take care.